Kia ora everyone, and welcome to the ACE RMO 2026 Wairau Hospital webinar. My name is Sam and I am the ACE RMO consultant. So today we're going to start off with an opening karakia, and then I will give everyone a brief outline of today's webinar.
Aio ki tarangi, aio ki te whenua, aio ki ngā mea katoa. I runa, I o tātou, hei reina, te hei, mōri, ora.
Thank you so much. So a big thank you to our panelists for being here today. We really appreciate this time that you're giving to share some really invaluable and valuable information. And a big thank you to our attendees who are able to join online today. It's really great to have you all here. So before we move into our panelist introductions, I'll just give a brief outline of what you can look forward to this afternoon. So we will start off with an introduction video, and then our wonderful panelists will take you through a presentation which will cover off some key information about their district and also a bit of an insight of opportunities that are available to you. And you will also be able to hear directly from them with regards to their experiences and working at the hospital and potentially what you can expect on a day-to-day. Towards the end of the session, we will have a Q&A session. So there is a Q&A icon above your screen. Please feel free and more than welcome to post your questions into that icon throughout the webinar, but just to note that we will only cover off those questions towards the end of that session.
Kia ora, I'm Adeline.
Hi, I'm Tegan.
We're both PGY1 house officers at Wairau Hospital.
Kia ora, Loretta Matheson, RMO team lead of Nelson Marlborough.
So my name's Gina Hart and I'm a house officer or first year junior doctor here at Wairau Hospital in Blenheim. Currently I'm on orthopaedics, so it involves rounding with the doctors each morning and coming up with a list of jobs to do for those patients, and then often in the afternoons I head off to theatre to go assist in surgeries. Well, I specifically wanted to come to a hospital like Wairau Hospital because there's no registrars here. So it means that as a house officer you have a really close working relationship with the consultants, and it also means that you get a lot of experience at making decisions and managing patients that maybe you wouldn't get at a bigger hospital. So it's been a very steep learning curve, but I wouldn't have it any other way.
Probably about 2 years ago I came to Nelson Marlborough and stayed here for a few summers while I was studying. Absolutely loved the place, loved the people, loved the sites, so I thought, why not work here as a PGY1? And
So one of the good things about the Nelson Marlborough District Health Board is that it's actually staffed really well. So when you want to get leave, as long as you put in sort of adequate time in advance, you usually get it, and it's a pretty rare occasion when you don't get your leave.
I'd say if you're ready to be sort of thrown into it and have to learn things really quickly, but still within a very supportive environment, if you're willing to have a really close working relationship with consultants and not have a registrar, and at the end of that feel like you've learnt maybe what you might have learnt in a year at a bigger centre, but learn that within months at a place like this, then I'd highly recommend coming. And also if you want to come to a place where when you leave the hospital there's just so much to do in the outdoors, and if you like good wine and good food, and also just be in a very relaxed and chilled out town where any stress that you might get from working in the medical world is often waylaid just by the environment that you're in. It's absolutely beautiful up here.
Wairau Hospital, we're a 65-bed hospital, and we're the base hospital for the Marlborough region, which services about 50,000 people, includes people in the Sounds and Kaikoura as well. Sometimes they come up this way. And we have a high dependency unit, so like a HDU and AAU, where patients sometimes they need a bit more close monitoring will go to. Or if they are only in for the night and then they get discharged the next day, they sometimes go there as well. We don't have an ICU, so if patients are more unwell or sicker and can't be managed in HDU or would benefit from high level of care, they go to Nelson or Wellington and Christchurch as appropriate. We do use the Health Connect South system, so it's an electronic system that across the South Island. So in terms of our bloods and our radiology, we can referrals, we can use that system to do that electronically. In terms of ward round notes, and drug charts, we're doing paper notes. And I think the good thing about here is also radiology wise, it gets reported relatively quickly, and we get to do CT scans pretty quickly. Yeah, we don't need to discuss it first before getting it, which is quite nice. So in terms of recruitment wise, for a small hospital is even more important, I think, your cover letter, just to express why you want to be in Wairau Hospital, why you want to work in Wairau Hospital, and also some of the qualities that we look for is a team player and being proactive. I think that's really crucial, especially when you're working very closely with your colleagues, either in the same year or with your bosses as well. And if you like the outdoors, have a connection or to the area as well, it's good to highlight that in your cover letter. You can also reach out to the RMO unit, so Loretta, if you'd like to have an interview throughout the year. Usually it's before, I would say I recommend doing it before the ACE applications close, because the interview is usually before that, and also take into considering the ACE scoring, and we'll consider your ACE scoring and the CV and your references as well.
So the positions that are available, there's 5 PGY1 positions, which has just been recently increased from 4 over the past few years. There's certainly been a recent drive behind increasing the numbers of RMOs on the ground in Wairau, which is needed as the hospital just is becoming fuller, and we're also taking some workload from Nelson or their outlying regions to help get through the Nelson waitlist as well. The runs that you can do in PGY1 aren't as expensive as the larger hospitals, but because of our sort of rurality and lack of subspecialties, you quite often are managing the same conditions that you would under a subspecialty, but just under the title of, say, general medicine. So the runs that we can do in first year are general medicine, then we've got our rehab run, general surgery / ENT, general surgery / urology, orthopedics, or relief once you've done general surgery and general medicine. Like I was saying, even though these runs sort of seem basic in their nature, when you're on general surgery, you're still managing, urology patients, trauma patients, ENT patients, plastics patients, vascular patients, either before they get transferred out or once they come back from their subspecialty. So even though we are a smaller region and don't have these specialties on site, they quite often will run their theatres once a fortnight, or specialists will come over for clinic, or you are essentially acting as the vascular house officer to carry out their management plan once they've been transferred back post-procedure. PGY2, you can do all of the above, and community. And so community here is sort of a hybrid mix, due to sort of the low number of community placements. So you can do urgent care. People quite often spend a little bit of time in the hospice space, which is sort of a unique option and really sort of hands-on and great to get involved in. And then we also have some GP placements out around the Marlborough region. You can also do 6 months of ED in PGY2, which is pretty unique to our hospital. Most of the bigger hospitals, once you get into like Christchurch, Dunedin, Auckland, you can't actually do an ED run until you're minimum of PGY3 or above. So it's pretty cool to get your hands on sort of before you need to make any sort of critical decisions regarding vocational training. Dip your toes and find out if you like it. You can also do O&G in pediatrics. The structure of the run has now changed to where we now have one O&G house officer and one pediatrics house officer. And that's to facilitate the PEDS diploma and the O&G diploma. So if that's an area of interest for you, once again, pretty unique to us because we do have the low sort of numbers that you're able to do this in PGY2 rather than 3 or 4 as it is in some locations. And then of course, there's always the relief run in PGY2 as well. So working in Wairau, so the average day is pretty nice compared to some of the bigger centres. Tends to be 8 till 4, and the 4 o'clock cut-off is sort of pretty hard. I mean, you get chased out the door by your colleagues if you're not gone by sort of 4:30, or they're going, what can we do to help you get out of here? It's a really sort of cohesive workplace, and everyone's really supportive, which is just amazing, especially when you're just coming into the job and going, oh my gosh, what's going on? It's quite a small patient load. Well, not quite small, but it depends on the day, really. Some days you can have 2 patients and other days you can have 10 to 14, just depending on when your boss has been on take and sort of what's been happening in the community on that day. The team sizes are varying a little bit. We've now implemented non-training registrar roles in a lot of specialties. So surgical orthopedics. There currently is a geriatrics registrar and a medical registrar. He was here for 6 months and is going to Nelson. He's bouncing back. So it's sort of a position that's floating at the moment, but it is really 50% of the teams at least have got a registrar here, which sort of does help. It's a bit of a unique registrar role where you're not directly reporting to the registrar, but they do just provide someone on the ground that's got a little bit more experience and maybe to run an idea past before you call the boss. But overall, the consultant or the SMO handles the call, handles the acute things most of the time, and not the registrars like they do in the bigger centres. We also have to do 1 long day per week that we're not working a weekend. So the week before and the week after a weekend, we don't do any long days. But when we don't have a weekend, we do a long day, which is about 8 o'clock till 10 or 10:30, depending on what's going down at the time that we go to handover. Most of the time, there is normally 1 or occasionally 2 people on the long days for the hospital, which is fairly manageable. Sometimes it can be a little bit rough, just being the only sort of RMO on the ground at that time. But we also do have someone doing the admission shifts as well. So that is another house officer who works from 2:30 till 10:30. We have that sort of week once per quarter. And that's just where you just sit down in ED and admit anyone into the hospital, regardless of the specialty, just get their paperwork and their medications together. And the weekends load is actually pretty good. We only have to do 3 weekends per quarter. So it's pretty consistently on around the same time every quarter. But the RMO unit is really amazing. It's sort of moving these around to allow fairness. And if you've got weekends that you can't work or have something on, you just let them know. And most of the time it can be accommodated. And so for those weekends you work, it's a 12-hour day. So 8 till 8 on both Saturday and Sunday. And if you go with RDA, then you get the RDOs either before the weekend or after the weekend, which definitely helps. In terms of teaching, most of the time we get zoomed in sessions from Nelson. So we have an hour and a half on Wednesdays and then an hour on Thursdays as well. The teaching is pretty good. Occasionally we have in-person sessions in Wairau, although I'd say definitely the having to be on Zoom sort of factor isn't amazing, but it's definitely made up for by the hands-on teaching that you get on the wards and all the other little procedures that you sort of get to do because of the lack of registrars or sort of the direct, I guess, working relationship you have with the consultants. It allows you to get a lot more opportunities that you wouldn't get to do necessarily in a bigger hospital. And yeah, we of course have those O&G and PEDS diplomas and PGY2 if anyone's interested, as well as the opportunity to step up as a non-training registrar in PGY3, depending on which specialty you're looking at.
Why come to Blenheim? Why come to Wairau? So I think most importantly is got pretty good work-life balance here, given that everyone's really working closely together, trying to get people out the door on time as much as possible. Yeah, like there's so much outdoor stuff that you can do. There's vineyards, can go on bike trails if you're into mountain biking, running along the Wither Hills. It's a really pretty place. I'm not originally from Blenheim, so it was a really nice change from Christchurch. And also you do get, because you're working so closely with the consultants, they're a really good resource and learning resource itself by working with them because they have so much the breadth and depth of their knowledge as well. You get opportunities to practice procedures and being called to theatre as well. And well, one of the reasons why I chose Wairau was because I wanted to have the opportunity to gain clinical independence and, gain confidence in that side of things. So if that's something that you think, you're also interested in developing early on in your career, I think Wairau is a good place to do that in a supported way as well. The RMO unit has also been great in accommodating our leave request as much as they can. And one of the few perks that's unique to Nelson Marlborough is that we get free coffee. If you're a coffee enthusiast, this is one for you. And also we get smoothies from the cafe that's in Wairau Hospital. If you don't like doing your washing, you get to wear scrubs every day if you want to. And your Wairau is also really nicely placed in terms of having close access to Nelson Lakes, Marlborough Sounds. Abel Tasman's not that far away as well. And if you want to pop down to Kaikoura, that's also 1.5 hour drive. So that's really, really handy. It's also not too far from Wellington. So if you want to fly to Wellington, it's a very short flight. And you're not very far from Nelson and Christchurch as well. So yeah, these are some photos we've got potlucks we try to do it every 2 weeks. This is open to not only the RMOs, but also the wider allied health team as well, whoever wants to join. So we've got a Wairau social chat that goes. So I guess that's a testament of us, not only working together in the hospital, but also hanging out outside of work. Picture on the top left was also one of our farewells for one of the British doctors that are leaving as well. So yeah, I think it's really nice being in Wairau and getting to know not only your colleagues, your medical colleagues, also getting to know the physios, the OTs by name, the nurses, you learn their names. They learn your names, you learn their names. It's just really nice putting a face to a name as well. Yeah, and working with everyone pretty closely.
Thank you so much. So just a reminder to our attendees, if you possibly might have joined a little late, there is a Q&A box or the chat box above your screen. If you've got any questions, this is a great opportunity, and now is the time to ask, and you will get your answer on the spot. And they're wanting to know, is selection mainly based off A score or interview/cover letter, and what time do interviews usually happen?
So with Wairau Hospital, it's interviews with one of the pre-vocational educational supervisors who's a physician, and he can pretty much interview any time that suits within trainee, intern and himself when he's available. So there would be an interview with him, and then before the selection process, yes, the CVs and cover letters would be looked at as to why they wanted to come to Wairau, and if they're interested in working in a small team, in a smaller hospital.
A combination, I guess, of the A score, combination of reviewing the CV and the cover letters, and then also the interview. So it's not particularly just the one thing that makes up that decision on that selection and ranking. Great, thank you. And just on that, I guess, Loretta, who's the best person for them? So they will get in touch with the applicant to arrange an interview, or should the applicants be reaching out to the district if they're wanting to potentially have those conversations ahead of time?
Applicants can just email myself, and I coordinate with Rion to either have a Teams, or you're quite welcome to come have a look through the hospital and meet some of the house officers, have a chat, and have a face-to-face interview.
Perfect. Thanks. So just to attendees that are online, you will need to contact the district directly. Loretta, I think your details are available on our ACE RMO website. So under the employer information section, you'll be able to refer back to that and be able to email through to arrange those interviews and discussions. I thought we'll just cover off a few common questions that have come through in previous webinars. One of the main ones has always been around accommodation. So is it easy to find accommodation?
I think accommodation can be a bit tricky in terms of, because unlike Christchurch, where there might be a lot more housing like options, Blenheim's not really like, you know, situated in that sort of environment. But that being said, for me, I was quite lucky. I knew a few of the PGY2s, so that really helped. So, and if you're struggling with accommodation, there is hospital accommodation that you can use first for a short term, and then you can talk to Loretta about it. And then after that, in the interim, I'm sure there will be people moving in and out and having changes in their accommodation plan. So that's when you have a bit more time. The good thing about Wairau is you've got hospital accommodation, which can buy you a bit more time to kind of help you get to know the people and then slot yourself in that sense. Yeah, so things will work out in the end. And if you're struggling, you're always welcome to reach out to Loretta, and Loretta can let us, the house officers, know, and then we can also, you know, liaise with you once your job is confirmed, that, you know, and see whether there are any openings in rooms.
And I guess that will lead me on to another question around parking and traveling to work, and potentially if someone's cycling to work, is there a bike storage available, for instance?
Yeah, so we are a bit small for public transport. So we don't currently have any public transport in Blenheim. But getting to work is fairly easy. There is tons and tons of free parking around the hospital. There's a designated park behind the hospital for the long day house officer as well. Literally, yeah, you've got more parking than we need in Blenheim, so that's never anything to worry about, and it's all free, all on the hospital grounds, which is amazing. Bike shed wise, I think there's 3 different bike sheds around the hospital. I think there's 2 or 3 of them that actually have locks on them or a code so that only staff can access. So it's super safe. I mean, Blenheim is pretty safe anyway. You can pretty much leave anything out and it really won't get touched or stolen, which is the nice thing about living here. So security's not really too much of a concern, but we also do tend to live, all the house officers do tend to live together, or we sort of live near each other. So quite often we'll carpool to things if they do come up as well.
Thank you. Well, we're almost at the end of our session, but I did hear that you have a really amazing gym.
Yeah, I think the gym, I haven't used it myself. I've heard of my colleagues who have used it, and it's a really good setup. It's in the basement of the hospital, so it's like easy to get to, easy to access, and I think it's like $3 a week, so it's a really good deal. So if you're looking for a gym membership, you can always go for the hospital gym.
Thank you. And I guess I will end off by asking one last question, and it's around, do you have any advice for our soon-to-be graduates that are going to be starting their PGY1 role, or anything that you can give advice on in terms of this timing regarding the application process?
I would definitely say it's important to for Wairau specifically, it's important to reach out and have an interview, just because we are such sort of a different hospital in the regard to the setup and the structure, that we do work sort of very closely with each other. It's important to know that the person that's coming in can work cohesively within the team. It's really important to reach out and have the interview to make sure that this is sort of the hospital that you're willing to come and work at, but also understanding that Wairau has its own quirks and at times can be a little bit sort of frustrating because we don't have all the resourcing that the larger hospitals do. And so if you're willing to sort of be pushed to your limits in a way with clinical medicine, thinking, okay, I don't have access to this, how can I sort of treat this without the standard sort of treatment means. It's really good and sort of makes you think a lot more, and also build your confidence really quickly, because you'll be doing things that only registrars were doing in the larger centre sort of within the first few weeks of PGY1, which is both terrifying but also incredibly rewarding experience to go through.
Well, I couldn't think of a better way to end this evening. So again, just a huge thank you to our attendees for joining, and to you, our panelists, for your valuable time here today. I know time and capacity is very precious, so we really do appreciate it.
Kia takaria te tapu, kia watea ai te ara, kia turuki whakataha ai haumie, huie taiki e.
Thank you so much. Just before I log off, I just wanted to make note that if you do need to get in touch with me with regards to any questions around your application process, I'm here to support and help you through. So please don't hesitate to reach out. My details are available on the ACE RMO website. And just a reminder, Loretta's details are there as well to get in touch and organise those visits and interviews. So on that note, thank you. Have a lovely evening, everyone.